DCTV 274 production, a channel meant to spread evangelical mission, reflections, church news, interviews on church matters, socio-political issues, and other marriage matters, both young and old. Nice content, all kinds of invitation cards, even movies. DCTV 274 production, TV for everyone.
Okay, no problem. I asked you this question, which should lead me to the next question, which is, what hope do you give to people who are around, to people who live around Okigwe and beyond, those who would desire to come here to receive wonderful treatment, hoping to get the best, and perhaps they do not have the financial stability?
I think if you've been following the history, if you've been following the events of Bavaria Catholic Specialist Hospital since inception, we've really, when I mean really, we've really tried to invest enough, both financially and otherwise, towards the service of humanity and saving lives, especially as in regards to the medical section. If we will recall, 2022, July to be precise, this hospital had a program called Health Solution 2022. In that program, we partnered with an organization, a German organization, Help Via Healthing. In collaboration with Help Via Healthing, we were able to do 5,000 surgeries free of charge without collecting a farthing. Lots of children, adults, youths, they benefited from this, and none of them paid. Bavaria Hospital have indulged itself in immense subsidizing of the medical rates. Especially, look around our community, we know that the times are hard. We know that people really, it's very difficult for them to even obtain things they eat, not to talk about the healthcare, obtaining good quality healthcare. In fact, when you tell people about going to the hospital, the first thing that comes to their mind is, I don't have the money. And because of this type of mentality coexisting in our community, that is why Bavaria Hospital have never relented in its efforts to alleviate the suffering of the people by providing them quality health care. That is to say that if the rich can actually access health, good health in a hospital, the same. In fact, when we look at our government today, access to health is something the government should provide. They are trying their best through the whole NHIS program, but there are still some indigent, really indigent people who cannot even afford, whether it is the gift ship program that the NHIS brought up, where you have people coming together paying 45,000 naira and then enrolling. Yes, that is the government's approach to ensure that people get themselves enrolled through insurance and also have access to these health care benefits. But the problem is that even amongst us, there are people who don't even make that 45,000 naira. There are people who don't even have that 15,000 naira to pay. And what do? Because they don't have enough fund, because they don't have somebody to assist them, they die of illnesses that are very, 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 very simple to cure. We all know that, yes, not like the Western world where you say malaria is not part of their thing and all that. But here in Nigeria, in Africa, in fact, we are friends to malaria because it's all over. But most time it becomes very pathetic. It becomes very, very annoying when you hear that someone died because the person had a simple plasmodiasis and over time was unable to get proper medications and the person died of it. I mean, for us in the healthcare sector, we feel very, very sad when people die as a result of minor illnesses, which, if they have the wherewithal, they will be able to give themselves good care. So that is why, in the light of that, Bavaria Hospital have tried over time to see how to give people succor in this aspect, to see how to consider people, be considerate in what we do by organizing free medicals from time to time. And these free medicals are those that the people pay, don't pay any further, like that of 2022, of course. That also, this year, 2023, we during the months of June, July, we organized something like, of course, we all know the crisis around the eastern section, Ihube, all those places. We had a kind of medical palliative while we called these communities that have been displaced, these communities that, I mean, majority of them, they've left their homes, they are destitute in many places, they are still looking for a place to lay their heads, they are out there in the cold, nobody is actually caring, okay, they can't even go back to their homes because majority of them have no home. We organized what we call the medical palliative, where we reached out to indigents of these communities. We asked them to come. They came to our facility. The doctors saw them, gave them their medications without collecting a further. So, through these little organizations, through these little programs, we try our best to ensure that the less privileged amongst us still have access to quality health care.
Okay, you often say we tried, we did. So are you still willing to open up your arms to welcome people, to welcome people who would desire after this or maybe seeing this video? Yes, in all sincerity, after all examination, after all consideration, and now these people do not have what it takes to get a good medical care which they desire to get and which they should get. So are you still willing to welcome them in the future?
Yes, if we've been accommodating this through the past year, I don't really think that moving forward that we are we are actually going to back down on that now.
Okay,
But you will also, I will still bring into light that we weigh situations. I will not make this, give all these comments without clearing the fact that situations are properly weighed. For instance, what I mean, the hospital have its social workers. What do they do? Once we have someone we think or presents himself to be indigent, we don't just treat like that. In as much as we're going to offer that help, our social workers gets down to work to investigate and be sure, even while the treatment is ongoing, to be sure that this person is actually indigent. So this is what we try to do, like a program. The hospital also partners with Health HEI. HEI means Health Emergency Initiative. Okay, what HEI does is they assist people who are RTA victims, yes, victims of building collapse. They help them up to a certain sum, I think 30,000 or thereabout. So after the treatment, if it exceeds 30,000, the patient bears the remaining cost. But the cost is not what we're actually talking about here. What we're talking about here that these are things put in place to still help people in their difficult situations. Of course, we know RTA patient, that is road traffic accident patients, they don't know they are going to meet with those accidents. They are just simple people like you and myself embarking on their normal business of the day, and then they are met with that. So when you bring patients like that, what do? There should be a kind of scheme put in place to assist those people. So that is where HEI comes in, and Bavaria Hospital is among those health care facilities that partner with HEI. And it is the help they give is to a certain limit, just like I mentioned earlier. So we are not going to, or rather, we are not planning on pushing out the indigent anytime soon. We will try as much as possible to help, as we also encourage them. Encourage a lot of people to also include in the various insurance programs and policies brought out by the federal government. In fact, as a matter of fact, Bavaria Hospital has its own platform where we have our forms filled, our social workers go out there, and then they certify that truly this person needs help. We have a form filled out, we collect a passport, and then we go ahead to render this treatment to the people. There are also situations we will actually need. This person is not actually indigent, but this person also needs help in one way. We also do certain things at a subsidized rate. For instance, surgeries. There was a time also we did, when you're talking about prostatectomy, for instance, is a very major case. Okay, it's a major surgery. When you go to other hospitals, you actually know the price of prostatectomy. But there was a time we were actually doing, those who have these cases, those who have these health conditions, they can actually come do these surgeries in our facility with nothing more less than 50,000. So as such, it is also in the process of helping the people. So you wouldn't say if I don't have 100, and that's what we did that 2 years ago. If I don't have the money, 100 and something, this, that. So from time to time, we put programs in place to sort out and answer these questions. Apart from that, Bavaria Hospital still remains like every other normal hospital where you come, access care, make your payments, and then get relieved or cured or treated of whatever you approach us with.
Okay, manager, your answer to my question is yes, because my question is after all cross examinations, after all investigations, are you still willing to accept these people? So, and you said it. So, thank you very much.
This is TV 274 production, a channel meant to spread evangelical mission, reflections, church news, interviews on church matters, social-political issues, and other marriage matters, both young and nice content, all kinds of invitation cards, even movies. DCTV 274 production, TV for everyone.